Good morning and good afternoon to all of you around the world. I'm Tirandi Pera, a student. I was a student at IIHS following the Advanced Diploma in General Nursing, and currently I'm a student demonstrator in the incubator unit at IIHS. I kindly request that all of you make sure that you silence your phones and maintain a quiet environment to ensure can fully engage in this session. Thank you for your cooperation. I warmly welcome you all to the international webinar on virtual reality stimulation in nursing and allied health, organized by the International Institute of Health Science, Sri Lanka, in partnership with SimX VR USA. As healthcare education rapidly evolves, the integration of cutting-edge technologies like virtual reality is revolutionizing training methods, equipping healthcare professionals with engaged skills and decision-making abilities. Today, we aim to explore how VR is transforming nursing and allied health education with discussion on its application, future trends, and for fostering of global collaborations with its innovative fields. A very warm welcome to all IIHS senior staff members, distinguishing guest speakers, SimX VR group, students from all streams, and also from healthcare professionals who joined with us through online. Now, I warmly welcome Mr. Nadun Ratnayaka, our Senior Lecturer and Head of Digital Learning and Education Technology at IIHS. He will provide an introduction to this special occasion. Please join me in welcoming Mr. Nadun Ratnayaka as he shares insights about our esteemed resource personals today to enlighten you all on their impressive background and contributes to the field of healthcare education with virtual reality. Over to you, sir.
Thank you, Tirandi. Good morning, everyone who joined us today physically and online through the Zoom platform. So let me give a brief insight to our guest speakers today. Ms. Kendal Bailey, Director of Nursing, Innovation and Strategy in SimX VR. Kendal Bailey is a dynamic nursing professional with a rich educational background and extensive experience in both clinical and academic settings. She has held leadership positions in the academic and healthcare sectors, designing educational activities that maximize nursing competence. Her roles have focused on utilizing virtual tools to improve educational performances, including 2D and 3D virtual reality applications. She works with SimX as a Director of Nursing, Innovation and Strategy, supporting nursing partners around the world in designing and integrating virtual simulations to enhance nursing competencies and professional development also. Her research endeavors have focused on the acceptability. Kendal is passionate about leveraging innovative technologies to enhance and user experience and learning outcomes. Our next speaker is Ms. Lauren Malmgren. Lauren is the production manager of SimX, where she manages the cross-functional operations for developing virtual reality medical training simulations. She works closely with professionals from a variety of healthcare settings to develop virtual reality training materials that complement other available simulation strategies. As a registered nurse, she also consults on development of nursing-related skills, procedures, and interaction for virtual design and development. Lauren received her BSc in nursing from Birmingham Young University and is licensed to practice in the state of Utah. She has experience as an inpatient bedside nurse in both acute and critical settings. She also serves as a consultant at Better Learning Experiences, a nonprofit that works to provide customized professional development in K-12, undergraduate, and professional school settings. Lauren is passionate about the advancement of medical simulation technology and hopes to make valuable contributions to the field of education, research, and curriculum development. So let's start the session, this webinar, with our first speaker. Over to you. Thank you so much.
Thank you so much. And I just want to take a moment to provide a warm welcome to this entire institution and audience. We are very honored to be here to help to share some of the innovative technologies we're using in healthcare education. Again, my name is Kendal Bailey. I have the honor of being the Director of Nursing Innovation and Strategy at SimX and am incredibly passionate about finding ways to leverage innovative technologies that really support outcomes and better healthcare professionals who are entering the healthcare workforce. I'm going to go ahead and pass it over to Lauren now to start our presentation, but both Lauren and myself are extremely honored to be here and very appreciative of this opportunity.
Yes, thank you, Kendall. Just want to echo everything that she has said. We are so excited to be here. So thank you so much for having us and excited to be talking about a topic that I think we are both very passionate about. So as we begin, as a brief description, this live presentation will equip nursing educators and students with the foundational knowledge of virtual reality or VR tools and their use in nursing and allied health education to enhance learning experiences. The objectives for this presentation, or for our time together, will be to describe the concept of virtual reality and its application within nursing and allied health education, to identify applications for VR within nursing and allied health education, and to examine the remote use of VR simulations as well. So to start off, let's talk about traditional simulation methods. Traditional simulation methods typically include use of a mannequin or a standardized patient or a patient actor. And there are a lot of really great use cases for traditional simulation. And this is probably the form of simulation that most of us are most familiar with. But there are also a lot of challenges with traditional simulation. And that's actually the reason that SimX even exists, because our founders experienced these same challenges that are commonly experienced with traditional simulation. They could only use their brand new Sim Center once a quarter because it was so booked out and unavailable. They saw how much time and effort it took for their faculty to replicate even one patient encounter. And still, after all of that work, the simulation really didn't feel like a real patient encounter. A mannequin wasn't working properly, or a standardized patient or patient actor wasn't trained properly. It really fragmented or broke that immersive experience. And they also knew how expensive traditional simulation methods can be and how limited the resources are. It can be very challenging to find well-trained standardized patient actors. And mannequins can cost anywhere from $50,000 to $250,000 US. So they're very expensive. And our founders knew that there had to be a better solution to this, something that was more realistic, more flexible, and more affordable. So imagine the possibilities where there's no limitations for a simulated learning event. The challenges that you experience with traditional simulation methods no longer apply. You don't need to reserve hospital equipment. Patient populations are diverse and they provide a multitude of clinical situations to train with. Students are challenged cognitively, and that really helps them enhance and train their clinical reasoning and clinical thinking skills. So let's dive a little bit deeper into some of the technologies that make that world a possibility. First one is artificial intelligence. Artificial intelligence, or AI, is a computer science that enables machines to perform tasks that require human intelligence. So AI uses math and logic and computational power to simulate human intelligent problem solving and decision making and learning. Telehealth is another technology emerging in healthcare where a provider is able to remotely interact with a patient over something like a Google Meet or a Zoom like we're doing now. And a provider can diagnose, treat, and assess a patient from afar. Extended reality is any technology that alters the physical world or real world by adding digital elements to that environment. And that's done in a couple of different ways. Extended reality is an umbrella term that encompasses virtual, mixed, and augmented reality. Virtual reality is a computer-generated simulation of a three-dimensional environment, and that three-dimensional environment can be interacted with by the participant in a very lifelike way. They can interact with tools and persons in a lifelike way, but it does require use of special equipment such as a headset or gloves with fitted sensors. Augmented reality is a technology that superimposes a computer or digital generated image onto your view of the real world. A great example of this is something like Pokemon Go. Some of us might be familiar with that, where there is a digital overlay into the real world. And mixed reality is kind of, I mean, the word is a good definition in that it is a mixed term, but it's used to describe the merging of real world elements and computer generated elements. And those real world and computer elements interact with each other in real time. To further break down our key terms and to further go into virtual reality, there are a couple different types of virtual reality. The first one is two-dimensional virtual reality. And this is where the simulation exists in just two dimensions, so length and width. Best example is something that is visible on a computer screen. And so learners can engage in a screen-based simulation through interacting with it with menu buttons or prompts. Whereas 3D or three-dimensional virtual reality is a fully immersive experience for students or any learner, and they are fully immersed in a virtual environment, and all other aspects of that environment are also virtual and able to be interacted with. So a learner can be in that virtual environment and interact with simulated tools, equipment, and individuals, just as if they were there in real life. There are no menu buttons and no prompts. And this is the type of virtual reality that is the foundation of SimX, and we'll actually be doing a demonstration of this a little bit later on in our presentation.
Thank you, Lauren, so much for explaining a lot of the context and the definitions we're going to use today. But I am very adamant that besides just the technology, there needs to be a benefit, and it needs to benefit both the student experience and student learning. Besides the advantages of resource allocation and a more cost-effective approach to learning, as well as something that's more accessible to a wide range of learners, it has to meet the needs of our students and our future healthcare professionals so we can make a greater impact on patient care. This coming from our current basis of literature. Other researchers have found as they explored these new technologies of VR simulation that this type of learning really does improve knowledge. It's a great pathway for that cognitive, knowledge-based acquisition. It's also more effective than conventional training methods. So when compared to other types of learning activities, such as traditional lecture or even low fidelity simulation, the outcomes are better and more effective for virtual reality simulation. As Lauren said earlier and painted this amazing picture, it can provide really complex scenarios where we have a robust set of tools and patient acuities that help support healthcare professionals for any patient encounter they're going to experience out in the real world. It also supports that psychological response. I mentioned the cognitive learning, but really the heart of healthcare, the heart of nursing is that patient interaction. It's the connection with another human. It's being able to communicate and talk with one another to not only meet their needs, but provide holistic care. And we have found that VR shines in this area because you can actually simulate a variety of emotions and responses and dialogue that needs to occur between a healthcare professional and a patient and their family. We also find not only do students learn more, they keep that knowledge for a longer period of time. It's not just short-term learning gain, that because these environments are immersive and engaging, students hold on to this information longer and they appreciate these encounters that are incredibly enjoyable, and it's a positive experience for students. We also find students feel more confident, that they can engage in environments where they can make mistakes and they are not harming patients. They can continue to repeat skills and go through scenarios until they feel confident in their skill sets prior to working with a live patient. As I said earlier, it's incredibly captivating. Many learners, when they get into this immersive space, are caught off guard by the fact that, wow, I can't believe I was in there. I thought it was real. I was so involved with what was happening with the case. And again, that really supports that intrinsic motivation and that willingness and that want to learn, which supports those better learning outcomes and gain. So students are engaged, students are motivated, and we're finding that we're creating healthcare professionals that know how to provide holistic patient care. But besides me just telling this to you, there are numerous studies, including a couple systematic reviews that have outlined the effectiveness of virtual reality simulation. So one of these first studies here really show that virtual reality simulations improve knowledge, skills acquisition, self-efficacy, self-confidence, nursing competence compared to those traditional methods. Another systematic review really confirmed the educational effectiveness of immersive VR and really delineated that it's a very effective and useful tool for healthcare education. And another study here also outlined that compared to conventional training methods, virtual reality was superior in its potential for advancing nursing students in their theoretical knowledge, practice proficiencies, and overall satisfaction. Now, this just really highlights 3 large-scale studies, but there are several pieces of literature that have looked at these outcomes for immersive virtual reality simulation. Now, as we talk about using these type of simulated learning experiences, the benefits here are multifaceted. We find that virtual reality applications have the ability to improve clinical skills. So students, learners have the ability to work on a variety of competencies here in a safe and controlled environment. This can include administering medications, completing a patient assessment, doing wound care dressings, inserting nasogastric tubes, and other routine healthcare interventions. And again, it's done in a way that we can confirm that not only are students following the correct procedure, but they feel confident in those skills as they enter the workforce. VR applications are also incredibly effective when we look at emergency response training. So when we think about the limitations of traditional clinical experiences, where sometimes students may not encounter patients who have had strokes or are in an acute phase following a heart attack or an MI, or even seeing very complex trauma cases, this is where VR can expose students to clinical experiences that they may not have access to, or within remote locations where they may not have these facilities that support these types of patients. So as we work through the team dynamics and the code-based skills that are required for highly critical acute patients, VR applications allow these experiences so students can then be prepared. As I mentioned earlier, I think one of the biggest areas that virtual reality shines is in communication training. The limitations of what current simulation modalities provide in just talking to one another. I don't get that nonverbal feedback of sighing and crossing my body, the nonverbal body language that we use to help understand what's going on with our patients and our families, to understand if what we're doing and educating to is effective. This is where we can provide applications that showcase patients with a variety of emotional needs. This is where we can see patients who can escalate and we need to work on those de-escalation and crisis intervention skills. We might have patient populations where we need to implement developmentally appropriate communication standards, from young toddlers all the way to our senior and geriatric populations who are dealing with hearing or speech deficits, and then all the way down to a variety of cultures where we can have a greater grasp on that cultural awareness and what we should be incorporating within our plans of care to support the needs of our patients. But finally, it's the clinical reasoning. It's that wonderful skill set that we want from our students as they enter the healthcare environment, that they can process, prioritize, and make and implement interventions that support positive patient outcomes. And to do this, they need to go through a variety of clinical scenarios where they need to work on their clinical reasoning and critical thinking skills. So through these immersive environments, learners are challenged to problem solve in real time. They need to recognize patient concerns, analyze patient data, and prioritize those interventions. VR simulations can also increase in complexity, challenging learners throughout their program, starting with initial knowledge-based skills all the way up to the ability to analyze and evaluate situations. This really allows for the scaffolding of learning all the way through a program, and it gives students the confidence to tackle more simple simulation experiences prior to taking on more complex scenarios. Now, one of the biggest benefits we're going to showcase today as well is VR's interprofessional training, which can be done within a remote application. So healthcare is never usually done by one person. Often patient care is done with a team of allied health professionals, nurses, and providers. And this is done through communication, order sets, working with our teams in emergency response. So through the SimX platform and these immersive simulated experiences, we can actually work as a team, honing in on those communication skills, ensuring that we're using closed loop communication, and that all of us are understanding and driving towards what that patient needs in real time. You can see here, this is actually an image of a multidisciplinary group working together to help care for a patient and their needs. Now, when we look at immersive virtual reality, it's also imperative to say, what do the students feel about it? As a learner, if I am not engaged and I don't enjoy what I'm doing, I'm less vested in that learning. I'm less likely to hold on to that knowledge and that emotional affective domain development. So from several qualitative studies, we do see that students will say that VR actually increases their attention because it's so interactive. They're not zoning out, that it caters to different learning types, that students feel like they can fail and do things wrong and learn from it in a positive manner without being scared about their concerns of hurting patients when they enter the healthcare environment. That the environment and everything was really realistic, that they can actually interact and use real healthcare tools and see those functionalities in response to the patient outcomes. That their skills training was easier in virtual reality environments, and that it provided a stressless learning environment for them to learn those procedures at ease. And again, that really just speaks to the confidence building, that self-efficacy, and that intrinsic motivation that these virtual reality environments can provide. Now, for today's demonstration, we're going to go ahead and also highlight its remote application. And really, by being a remote application, we can really benefit the learning experience across a very wide space. We can provide that equitable learning for institutions that may not have access to pediatric or trauma-based facilities. Learners now have the opportunity to engage in a wide range of populations and patient acuities. It also is much more cost effective. Instead of having to maintain large simulation centers or spaces, ensuring that we have the accurate tools and resources to make mannequin-based simulation realistic, this can all be managed within that same software program and ensure that we really see that immersive, realistic environment. It's also scalable. We can use these platforms across multiple institutions, helping to leverage the resources of our faculty members and instructors. And as we pointed out earlier, you can have this real-time collaboration with these repeatable and customizable simulations to ensure that we're meeting the competencies of high-level healthcare professionals entering the field.
Right. Thank you so much for that description as well, Kendall. We are very excited to be moving to the live demonstration portion of our time together today. So Kendall is going to go off camera and she's actually going to get into one of the headsets and we're going to screen share a live video demonstration of our SimX platform. So as Kendall mentioned, we do have remote capabilities with our software. So what is possible with this platform is that, we could have students all the way here in the United States and students there in Sri Lanka participating in the same virtual simulation together at the same time. What we'll be demonstrating today is I am based in Salt Lake City, Utah in the United States, and Kendall is about 600 miles away from me. So I will be moderating a scenario while she participates in it. And we'll also have another learner in the simulation who is, again, almost 600 miles away from Kendall participating in this. So just want you to notice really the power of having these remote capabilities to allow users and moderators to participate together. It really breaks down geographical barriers to having high fidelity simulation experiences. So before we start, want to give a quick disclaimer and quick description about the simulation we'll be witnessing today. So this is a med-surg urinary tract infection DKA simulation. This patient is named Patricia Walker. She's a 44-year-old female admitted to the med-surg unit from the emergency department. And she has a diagnosis of a UTI and DKA. As a disclaimer, this is a simulated patient. We do get a lot of feedback that these simulations are so realistic that people think these are real patients and real providers taking real medical care of a real patient. And I just want to reiterate that this is a simulation. This is a simulated patient. In no way is this a real patient receiving real medical care. This is purely a simulation. So I am going to switch my screen over so we can see Kendall and Wes in the scenario. So give me one moment while we do that. All right, and hopefully everybody can see my screen here. I'll be moderating this scenario, but as you can see, we've got kind of a red floating head and hands and a green floating head and hands. Kendall, go ahead and raise your hand. Let us know which one you are.
Hi, everybody.
Kendall's our red player. And then Wes, go ahead and raise your hand.
Hey, everyone.
There we go. So Kendall and Wes, go ahead and give each other a high five real quick. So as you can see, both of those individuals are able to participate in the simulation. They are synced virtually so that they can collaborate, and we'll show you that in real time. All right, you guys ready to get started?
Yeah, I think we're ready for handoff, Lauren.
Okay.
Yep.
Hi, are you ready for handoff?
We are.
This is Patricia Walker, a 44-year-old female with a history of type 1 diabetes, hypertension, and hyperlipidemia. She came into the ED this morning with vomiting and was found to be in DKA. Her CO2 was low and her pH was very low. She received a fluid bolus in the ED, and we just started the insulin infusion. A UA was sent in the ED, but if you need a urine culture, you'll have to collect another sample. The hospital doctor ordered an antibiotic, but we haven't had a chance to give it yet. The patient's husband is here with her and can give you more information. Any questions?
No, I think we're great to go. Thank you so much.
All right, have a great shift.
Hi, Miss Walker. It's so nice to meet you. Do you mind real quick, can you confirm your name and date of birth for me?
Hi, Patricia Walker. My birthday is December 23rd.
Thank you so much for confirming that. So I got a little bit of a report from the nurse, but can you tell me what brought you in and how you've been feeling?
I started not feeling well about 3 days ago. I was really nauseated and then started vomiting. I haven't been able to keep anything down in days.
Oh, I'm so sorry to hear that. That must have been really difficult. And I do see that you have a family member here with you. Can you tell me who this is for you?
This is my husband, James.
Hi,
Hi.
James. It's very nice to
I'm
meet you.
James, Patty's husband.
Wonderful. Well, my name is Kendall. I'm going to be your nurse today.
Hi, and I'm Wes. I'm a student observing with Kendal today.
And we're just going to
Hi.
we're going to go ahead and just get our hands washed, and we're going to go ahead and put on our gloves. And if you don't mind, I'd like to go ahead and get a patient assessment from you. I know it sounds like you haven't been feeling too well, so I'd like to get a little bit more information if that's okay with you.
Okay.
Wonderful. Okay, Wes, let's go ahead and wash our hands. And would you mind passing me a pair of those gloves?
Yeah, absolutely.
Thank
There you
you.
go.
Now, Miss Walker, I'm going to go ahead and listen to your heart and lungs here. And then if you don't mind, I'm going to go ahead, we're going to get a set of vital signs from you. We're going to see what's going on. And then I'm going to go ahead and get bedside glucose from you because I do want to see what's going on with your blood sugar, especially since you haven't been eating very much lately. It does look like right now your heart rate is a little higher at about 120. Let me go ahead. Let's take a quick listen to you and see what's going on. Well, your heart and lungs sound good. And I do hear some good bowel sounds, which is nice. Wes, can you go ahead and get a blood pressure for her? And then I'm going to pass you
Yeah.
this thermometer if you can get her temperature too.
Okay. Yeah, grab that. Thank you. All right, Patricia, I'm going to slip this on your arm, okay? And then a quick tap on the forehead. All right, so it's 100.4 Fahrenheit.
Oh, that's a little bit of a fever. That's 38 degrees Celsius. That's
Okay.
a little high, especially since she hasn't been feeling too well. I know she needs those antibiotics, so we should get those started here in a second. But Miss Walker, I'd like to go ahead and I'd like to get your blood sugar first, especially since you haven't been eating very much. I do know that we just started that insulin medication. Wes, do you mind grabbing her pulse ox for me?
Yeah,
So you're just
absolutely.
I'm just wiping your finger right now with an alcohol pad, and then you're just gonna feel a little prick there so we can get a blood sample. Okay. Ooh, Miss Walker, it does look like your blood
Very
glucose is
high.
a little high. It's 300 right now. So hopefully we're gonna watch and see what that insulin does. I'm gonna have to recheck that here in a little bit. Is that okay?
Yes.
Okay.
I
And I'm
haven't
going
been
to
good
put,
at taking my insulin lately.
Oh,
I
okay.
definitely missed a few doses.
Well, thank you so much for telling me that information. It definitely helps me understand what's going on and figure out how I can help you best. Okay. Wes, would you go ahead and take a feel for her radial pulses? I'm going to check
yeah.
her feet and see.
Okay, I've got radial pulses.
Her pulses feel good.
Yeah.
Felt okay to you, Wes?
Yeah, they
Okay.
felt okay.
Miss Walker, I'm just going to go ahead and take a look at your eyes, okay, with this pen light. Perfect. Now I'm going to look at the other side. Fantastic. Thank you. You know, Miss Walker, I'm a little concerned right now because you do have a higher temperature. I think we should start those antibiotics, but I do see that you have a sulfa allergy. Is that correct?
Yes.
Oh,
I'm allergic to sulfa drugs. They give me a rash.
okay. That's really good to know. I want to go ahead and double check that medication we got ordered from your provider since you are allergic to sulfa medications. Wes, what kind of orders do we have? Oh, it looks
Right,
like
yeah.
she does have a sulfa medication ordered for her antibiotic right here. Yeah, we need to call the doctor and get a new
Yeah,
order.
okay.
We can't give her that medication.
Okay.
Hello, this is the hospital operator. How can I help you?
Hi, can you please connect me with the provider for Miss Patricia Walker?
Okay, I'll connect you.
Hi, this is Dr. Banter.
Hi, this is Kendall. I'm currently here taking care of Miss Walker. We're a little concerned right now because her heart rate is a little higher. She's sitting about 120. Her blood pressure is a little lower at 105/60, and she does have a temperature of 38 degrees Celsius. I also found that she has a sulfa allergy, and we do have a sulfa medication ordered for her. I do think we need to have a new medication ordered due to her allergy.
Good catch on the allergy. I'll put in a new order for ceftriaxone 1 gram IV. Make sure to collect a urine culture prior to giving the antibiotic. After you give the antibiotic, can you recheck a basic metabolic panel?
Will do. Thank you so much.
Thanks.
Now let's make sure. I know he most likely puts those orders into her medical record, but let's check those again just to
Okay.
make sure for that new medication. Oh, there we go. He switched it over
Yep.
now to that ceftriaxone. Good. So now we know we have the right medication ordered. But before we start those antibiotics, will you go ahead and grab a urine sample from her?
Yeah. Hey, Patricia, I've got this cup here for a urine sample. I'm going to hand it to you, and I'll go ahead and let you fill that. Awesome. Thank you. I will just check to make sure that the labels are correct. Is correct. All right, and I'll just put this in the tray over here, Kendall.
Wonderful, because I have to get this lab work and then we can send that down
Okay.
to the lab once I'm done. Mr. Walker, I'm going to stand right next to you, but I'm going to go ahead and get some laboratory work from your wife. Is that okay? Miss Walker, is that okay for you too?
Yes.
Okay. So I am going to go ahead. First, I'm going to take off this blood pressure cuff so I can get a good look at your arm. And I'm going to go ahead and place this tourniquet. Now, Miss Walker, while I'm doing this, I know nobody enjoys having a needle stick here, but I promise I'll be as gentle as I can to get this lab work from you, okay? So you're going to
Okay.
feel a little stick
Thanks.
there. Okay, good. I can see that vial filling up. I'm so glad we have a couple vials that we have to do here, so we can send this off to the provider. Two more. Great job, Mrs. Walker. Last one. Great job. Let me go ahead and take out this needle and I'm going to go ahead and put a Band-Aid on you. And I'm going to drop this in the sharps container and we'll get that lab work right on over to you, Miss Walker. Thank you so much. You were a great patient with that.
Thanks.
Okay. Now, Wes, once I get this lab work sent off, I think we should go ahead and start that new medication if that sounds good to you.
Okay, yeah. Do you want me to start a new IV for that?
I think so. Miss Walker,
Okay.
since you already have fluids running and insulin, we do need another IV to give you this new antibiotic medication.
Okay.
Okay. Wes, I'll go ahead and have you insert that IV for me, okay?
Sounds good. I'm going to grab an alcohol swab and a new IV here. All right, Patricia, I'm going to stick this on the top of your hand, okay? So a little alcohol first, and then quick poke. Here we go. And then I'm going to go ahead and throw that alcohol swab away.
And then here you go, Wes. I will grab you. Oh, you got your flush
you've got it.
already there for you.
Perfect.
That way you can make sure that IV is patent.
Okay.
And here's that new alcohol swab for you.
Awesome. Let me swab that off and then run that flush. Go.
Awesome. Thank you so much, Miss Walker. I know it's never any fun to have all these needle sticks. we're just going to go ahead and get your medication now. So that way we can hopefully get you feeling better. So I'm going to go
Okay,
ahead. Let me
thanks.
grab this new medication here. Wes, will you confirm this medication with
Mm-hmm.
me that we're giving that ceftriaxone?
Yep,
Yeah.
that's what
Okay,
I've got.
perfect. And will you confirm it with our orders on the tablet as well? I
Yes,
just want to make sure that we aren't
absolutely.
missing anything. Okay,
Okay.
1,000 milligrams and 250, and we need to give it in 30 minutes. Okay,
Okay.
fantastic. If you don't mind putting this on the IV pump for me.
Yeah. Okay. And I'm going to go ahead and program the pump. Do you want to confirm this before I connect it and start it?
Yes, please. Oh, great job programming it so it'd go in that 30 minutes. That looks great. If you want to connect it to your
Okay.
patient, here's another alcohol swab,
Perfect. Thank
and
you.
then we can get that running.
All right. And push start. And that is running now.
Great. Thank you so much. Now, Miss Walker, I'm so sorry, but I'm going to have to do one more thing here. I'm going to go ahead and get another blood sugar. Now that we've had that insulin running for a little bit and we have those antibiotics, I'm hoping that your blood sugar has come down a little bit. Okay, so hoping this is our last little finger prick here. Oh, and look, Miss Walker, your blood glucose has come down. You're now at 195. So that's fantastic. I'm so glad to see that that insulin we're giving you is helping you and helping your blood glucose. How are you feeling
I'm
right now?
feeling better. Thanks.
Oh, that's
Good.
fantastic. I'm so happy to hear.
All
Well,
right. I think we did a great job, Wes, Kendall. Great job taking care of Miss Walker over there. Wonderful job.
well, thank you so much, Lauren. I'll come on over, but that was such an awesome experience.
All right. So as Kendall is getting back out of the headset, she's going to join us back here for the rest of the presentation. I'm going to share my screen back. But a couple of things that I just love pointing out about these scenarios is really how immersive they can be. You know, that's why we often get the confusion that these are real patients and real patient care, because those learners were really able to go through all of the motions, use all of the equipment. They were able to engage in a meaningful way with that patient. And really have a high fidelity clinical experience to train on the things that they need to learn to be effective healthcare providers. A couple of other things that you might have noticed is that those two learners were able to collaborate with each other in real time, able to hand each other tools back and forth, and you could see that they were able to really work together and engage as a healthcare team in addition. All right, I think we have Kendall back with us.
I do. And I was going to say, I've now jumped and worked with people across hundreds of miles and had an awesome experience. And what I loved is really seeing that patient care, I saw the outcomes. Her blood glucose was coming down. I was able to identify that we had an allergy concern, and I was able to go through a variety of nursing skill sets. And that case could only be improved if we had some more of our allied health partners, or even other cases where we can include them to really coordinate that plan of care. But I think this is our hopeful time. We'd love to answer any questions anyone from the audience might have. We know that these are sometimes new and different experiences, and Lauren and I are always open to help explain and explore any thoughts that you might have.
So thanks a lot, Ms. Kendal and Ms. Lauren, for your valuable insights and for the discussion of today. And the demonstration was very informative and it was great. So next up, the audience. You have the questions. You can ask any questions you have and clarify it.
May I have a small question? Can I know what are the benefits of using VR simulation in nursing education particularly?
And
Can
so
you please stand if it's possible? Sorry.
So what I heard was a question around the specific outcomes for nursing nursing education for virtual reality simulations. And very similar, actually, several of those studies and pieces of literature I pulled up earlier really do highlight that within nursing education, that nurses who are using this type of simulated learning experiences are feeling more confident, that they have that motivation to learn, that they have great knowledge, cognitive and effective, that emotional domain development, and they're really able to work on those team-based skills. We also work with many institutions that have been able to incorporate these technologies, not just in simulation, but in their classroom experiences, as well as their lab and clinical rotations. And they really have seen that this has given them another tool in their toolbox to ensure that they can provide experiences or scenarios that they are otherwise not able to do, whether that's due to the resources or the type of clinical opportunities they have close by.
Okay, well explained. Thank you very much.
I can see we have a question in the chat. Figured we could address that one. It says, hi, Ashen here. Just wanted to know if SimX has any simulations for aged care setting. The answer to that question is yes. SimX has upwards of 250 scenarios available for simulation training, and that extends across a wide variety of patient demographics, ages, and ethnicities. And so there's a host of opportunities for training.
I have one question. How does VR stimulation compare to traditional clinical training?
So actually, there is a large body of evidence that says simulation in general is as good or not even better than traditional clinical rotations. That simulated experiences, because of the fact that they're low risk, that you have that opportunity to debrief and understand what you may have done well, or maybe areas of opportunity, that simulation in and of itself is an incredibly effective learning tool, specifically in healthcare education, in nursing education. And that really, we have found that sometimes it's even better, again, dependent on the type of clinical experience you have. Sometimes you can go to a labor and delivery ward or go to a critical care unit and maybe not experience a highly critical patient or see a trauma patient or have somebody deliver. And so through simulation, you can have all of those experiences and ensure that you feel comfortable and you develop those clinical reasoning and problem-solving skills before you go in and take care of patients within the healthcare environment. So there is a lot of literature to support simulation, especially even as clinical replacement or a clinical enhancement.
I have a small question. I want to know at the same time how many students can participate in a setting of managing a patient, like in cardiac arrest or something like that, need more staff members of managing the patient?
That's a great question. And I think that's one of the reasons SimX can be so beneficial for healthcare simulation and allied health education. As far as the limitations for the number of students that can participate in the simulation at the same time, we actually have never really found the limit for that. We've done some internal tests as far as how many headsets we could get in a simulation at one time. And I think we maxed out around 11 or 12 headsets or participants. All of that to say, it is incredibly realistic or incredibly possible for you to structure a simulation with a provider, with a nurse, with a respiratory therapist, with a social worker, and have the patient there. All of those individuals able to collaborate and care for that virtual patient at the same time.
Okay, I have a question. What types of scenarios can be simulated in VR?
That is a great question. And I will say right now, because of the technology, the sky has been the limit. So we have a variety of simulated scenarios that start all the way down through women's health, So a variety of scenarios that are managing labor, the postpartum period, newborns. We have a variety of pediatric simulations supporting infants all the way through adolescence, through a variety of clinical experiences, whether they're in school, in a hospital setting, whether they're in a clinic space. And then we also have a really robust set of cases for medical surgical nursing, critical care, emergency training, community health, public health, and then trauma-based scenarios. And again, all of these can simulate a variety of patient ages. Again, from a brand new newborn, and you're responsible for managing that baby right after delivery, all the way up to the palliative care and hospice state as we're helping a patient transition and really looking at that end of life care. And so for right now, we've had simulations across the board. I will also say we work with a variety of healthcare and academic partners. So we have a robust set of pre-hospital settings where we have cases that are out on a cliff or near a pool for a patient who might have just had a drowning experience, all the way through that community health, clinic-based setting, community-based care, inpatient care, surgical scenarios, OR spaces that have really allowed us to have a wide range and variety of simulated experiences.
Hi, Kendall and Lauren. It's Nadun here. I have a small question. We know that you guys are practicing this technology from long period of time. Now, what is the perception from student point of view regarding the effectiveness of this technology in nursing care?
Wonderful question. And I will say that there are some great qualitative studies that are really looking at that student experience. Just to look at that again, what we are finding, our students are adult-based learners, right? And so for adult-based learning theory, adult learners want to be interested in what they're doing. They want to make sure that it applies to their practice and what they're going to be doing in healthcare within their role. They want it to be a problem-solving scenario. They want it to be engaging. And that's what we find in these immersive virtual reality simulations. So really, these are meeting those adult learning theory tenets, and learners are getting in. And again, very realistic. It's easier for students to engage with those tools and then really have that magic of learning, of looking back and reflecting on how they did in that scenario, taking the time to either watch themselves in that recording or work with a faculty member to discuss how they progressed through that case and where they can grow and change. And so students, usually we find that students, even if they're a little apprehensive at first, once they get into that headset and that immersive space, they're saying, it's engaging, it's realistic, it's building my confidence. I want to learn in these environments, and it's helping them feel like they're going to be a better healthcare practitioner as they enter the workforce.
Thank you so much.
So is there any other questions you want to ask?
Wish to ask one question as an educator. What strategies can be implemented to ensure that all nursing students, regardless of their background or the learning style, they benefit equally from simulation-based training?
I absolutely love that question. And the reason I like it is because there is a very frameworked, evidence-based approach to using simulation. And part of those tools are ensuring that your learners have the opportunity to pre-brief and understand what they're going to be doing in that simulated case. So one strategy, like you saw today, Lauren ensuring that we had that handoff report from the nurse, that we had the opportunity to ask questions and we knew what we were going to be engaging with in that patient care. We have a robust set of student support materials and faculty support materials. So that way you can pre-brief and prepare your learners through that technology orientation and the clinical orientation. So when they get in headset, they are really focused on what is the clinical problem that they're seeing, what are the cues that they're recognizing from their patients, what do they need to implement, and then evaluate as that final stage of that nursing process. And so I would say I always align to the standards of healthcare simulation, and that being a technology orientation for your learners and a great pre-briefing so that way learners understand the clinical environment they're going to engage in, just like you would receive a handoff report in a clinical rotation from the nurse that you're working with or your clinical instructor.
Any more questions you want to ask?
Hi. Hope you can hear me.
Yeah.
Thank you very much for the wonderful session. And I'm a physiotherapist, and I'd like to know the possibility of using this technology for on-field physiotherapy scenarios, or is this technology is confined only to clinical settings? I would like to know about that.
Just to clarify what your question is, when you say on-site scenarios, are you talking about engagement with an actual patient? So a patient can maybe be in the immersive environment and do those skills or go through those sets of procedures with you? Or are you saying, asking more about simulations that can align to that allied health scope?
Well, I'm asking about the simulations that can go align with that.
Yeah, and that's a great question. I will say that as our company continues to grow and the healthcare professionals that we've been working with, at this point, we have cases that we have developed in conjunction with providers for residency and medical school training. We have pre-hospital based scenarios for EMS students and paramedics and firefighters. We've got cases that support the development for respiratory therapists. We have phlebotomy components, social work. We've even built out cases for chiropractic in cases as well. So at this point, as we continue to develop and grow, we do have cases that can align to different sectors of that allied health area. It would depend on what your learning objectives are and what you hope to see within those simulated experiences. But as a company, we have chosen to really develop and look at a variety of healthcare professions and work on developing simulated scenarios that support those different areas. So as of right now, we've had kind of sky is the limit, and we continue to work with new and different and develop healthcare scenarios for a variety of scopes.
So if you have any more questions, you can ask. All right, so feels like that's the end of the questions. Thank you, everyone. Thank you so much for actively participating in the Q&A session. We appreciate your enthusiasm and the involvement, and special thanks to Ms. Kendal Bailey and Ms. Lauren for answering the questions. So I'll take a moment to tell you about the link regarding today's session. We'll be sharing it in our IIHS groups. So please take a moment to fill the link and give us your valuable feedbacks about today's session. So in conclusion about today's session, today's webinar has shed light upon the transformative roles of virtual reality, stimulation in nursing and allied health education. We've also explored practical applications. We have also witnessed a live demo, which is a very informative scenario. And we have also engaged in an insightful discussion. Thank you for esteemed speakers, Ms. Lauren and Ms. Kendal, and participants for making this event a success. We look forward to continue collaboration in advancing health education through innovative technology with SimX in the future. And there's a special thanks to Mr. Joseph and his team members for organizing this event. It was a wonderful event. We're pleased to inform that all the participants will be receiving an e-certificate, and the certificate will be sent to your email address provided in the attendance sheet that is circulated, also registered through online. So people who are registered, they'll also be getting this e-certificate. That's the final of this webinar. Thanks a lot for participating. Thank you, Ms. Lauren and Ms. Kendal, Mr. Joseph, his team members, and everybody who participated. Thanks a lot, and have a great day. Thank you so much.